An internationally renowned cancer doctor says Pharmac is ignoring clear evidence by refusing to fund new life-extending drugs. New Zealand's advanced breast cancer patients are dying far quicker than other developed countries. As Pharmac considers yet another application to fund the drugs, there are calls for an independent review into its funding model. Our reporter Alex Perrottet and cameraman Nick Munro have been investigating.
It's the most commonly diagnosed and deadliest cancer for New Zealand women. It claims 600 Kiwis a year. And for people suffering breast cancer in its advanced stages, just the talk around conferences and in online communities of people living longer and more comfortably fuels their hope. In recent years, new drugs have become available that have proven to give those crucial months and years.
People's quality of life and their ability to take medication or treatments that will prolong their life means that they'll be able to spend time with their children, an extra 1 year or 2 years to see your child get to school or to reach a significant milestone. That is the kind of thing that we mean in New Zealand normally by quality of life.
But National MP Maggie Barry and plenty of others are concerned that there's a new normal where the limited budget for cancer drugs has no room for those who are considered terminal. Sue Walcade is one of the 300 women diagnosed each year with advanced metastatic breast cancer. She might not live to see 2020 and says the medical industry seems to put them in the too hard basket, sending the message that treating them is not as important as curing others. The message hit home when she was seeking advice on whether to take a short trip away and miss a treatment visit.
My nurse said to me, so it's okay. If it was a curative treatment, then I would be concerned, but it's not. So I just sat there and went, ooh, ouch. So for stage 4 is all our treatments are palliative. They're not curative.
Dr. Fatima Cardoso is a senior medical oncologist from Portugal and founder and chair of Advanced Breast Cancer Global Alliance. She has a scathing review for this country's provision of cancer drugs.
So we have drugs that really improve survival by a substantial number of months. And in countries where there is access to those drugs, the median survival of these patients is about 60 months, so 5 years. And in New Zealand, in the report, they have just 13 months. So clearly, there is a lack of access to drugs that save lives.
Yes, you heard that right. Patients in New Zealand, on average, are dying far quicker than in many other countries.
I'm afraid that within the well-developed countries, it ranks quite badly, I'm afraid to say, because there are certain types of treatments that I believe could certainly be affordable for a country like yours.
Tracy Barr-Smith was clever with her cancer. In 2012, she self-diagnosed, got onto it early and followed all the advice. But she's always felt that those who should be helping her could and should have done a lot more. When the cancer came back in 2017, she was misdiagnosed for months, with doctors saying it was just a bad back. And when she finally got in front of an MRI scanner,
I just lit up the screen with metastatic breast cancer throughout my spine.
Now all she's asking for is a drug that will give her a few more vital years.
I just can't picture my life being that this is all I have to give, that in 2 to 3 years I could be gone, when I'm only 48. I'm not even 50. And right now, the way everything is going, the way you're hearing the reports, I'm unlikely to make it to my mid-50s. I'm young, I'm vibrant, I've got so much to give. I want to work, I want to live. I've got a family that needs me. I've got parents who are in their mid to late 70s. I can't even imagine what they're thinking, that they potentially could be burying their daughter before they pass on in this world.
Sue Walcade says as time marches on, her options in New Zealand aren't all that appealing.
I will be at a point where I need to make a decision whether I go on to another type of chemo, and you know all the toxicity that comes with that, or look at the unfunded option, which is the Kadcyla or the TDM1, which will cost me 10 grand a month. So, you know, whether I go down the path of the New Zealand's new health scheme called Give a Little Page.
Sue says she's gobsmacked that Pharmac last year announced $200 million in savings over 4 years.
I don't think it's lack of budget, but I think it's lack of whatever the strategy or objectives for Pharmac are. They're wrong. They simply must be wrong. If we are lagging behind out of 28 OECD countries, then something's really wrong. Something is really vitally wrong.
Dr Cardoso says for these women, an extra year or two in the face of such a disease is the epitome of survival. And two options that could very well help them are not funded by Pharmac. Her organisation, the Global Alliance, ranks the effectiveness of drugs currently on the market and available to OECD countries. 1 means ineffective, 5 is very effective. She says Kadcyla, or TDM1, is ranked 5 out of 5. And Ibrance, while not as effective, is crucial in giving greater quality of life. They are funded in other countries such as the UK and Australia, but not here.
These drugs should be your top priority because this is where you can have the biggest impact in terms of survival.
Pharmac's chief executive Sarah Fitt was not available for an interview, but sent us a statement saying that while the treatments look promising, they only offer modest benefits to patients and the price is prohibitively expensive. She says Pharmac has received further applications for them to fund the drug, but they'll only look at those applications later this month and publish the discussions later in March. But here's the thing, Dr Cardoso says the tests have been proven beyond doubt. And if Pharmac simply admitted that the only impediment was the cost, then perhaps greater pressure could be put on the government.
They cannot say that the benefit is not demonstrated. The benefit is demonstrated. The scale is an objective way of grading that benefit. Then another discussion is what are you willing to pay for that amount of benefit. But then they cannot use a reason to say that they do not fund that the benefit has not been proven, because that's not true.
So, another discussion paper to be published next month. But for these patients, every month is both a milestone and an incredibly painful wait.
It just seems to me that they are doing whatever they can just to put us off and not to address the situation.
A 2018 report by the New Zealand Institute of Economic Research said an excessive focus on price and an inability to take advantage of new opportunities can end up costing the health system more. The report called for investigation into what it described as missed opportunities. Maggie Barry says she and the National Party support that call.
The Pharmac model at its heart is good. I think that it would be very helpful if the government agreed to fund it at a better level. $200 million has been not put back into funding for Pharmac as an investment, money that the Labor government has taken away and reapportioned. I think that's wrong. I think that $200 million that's missing needs to be given back to Pharmac.
Tracy Barr-Smith says the review must be independent.
I don't know of any other company that can spend that amount of money and not be accountable back to their shareholders. We as a New Zealand taxpayer are our shareholders, so they need to be accountable to us for how they spend that money.
Sue Walcade has a clear message for Pharmac.
Accept the evidence that's already out there and stop asking for more. If it's good enough for Australia, if it's good enough for America, if it's good enough for the UK, then it's good enough for New Zealand, unless do New Zealand have different blood. Why don't you understand that the evidence is already there?
And she has an even more direct message to the Health Minister, David Clark.
Wake up. Do your job. Pharmac's answerable to you. You should be asking questions.
Sue Walcade ending that report by Alex Perrottet and Nick Munro.